1. What is the primary risk factor for the development of osteoporosis? A. Smoking. B. Low calcium intake. C. Female gender. D. Excessive exercise. Answer: C. Female gender. Rationale: women are at a higher risk due to hormonal changes, especially postmenopausal women who experience decreased estrogen levels, which accelerates bone loss. While smoking, low calcium intake, and excessive exercise can contribute, the primary risk factor is gender. 2. Which of the following is a clinical manifestation of osteoporosis? A. Joint stiffness. B. Bone fractures with minimal trauma. C. Muscle weakness. D. Skin rash. Answer: B. Bone fractures with minimal trauma. Rationale: osteoporosis is characterized by brittle bones, making individuals more prone to fractures even with minimal or no trauma. Joint stiffness and muscle weakness are not typical manifestations of osteoporosis, and a skin rash is unrelated. 3. What is the most common site of fractures in individuals with osteoporosis? A. Wrist. B. Hip. C. Spine. D. Ankle. Answer: B. Hip. Rationale: hip fractures are the most common and serious type of fracture in individuals with osteoporosis, typically due to a fall. Although wrist and spine fractures are common, hip fractures are particularly concerning due to their potential complications. 4. Which diagnostic test is used to assess bone mineral density, BMD, for diagnosing osteoporosis? A. MRI. B. CT scan. C. DEXA scan. D. X-ray. Answer: C. DEXA scan. Rationale: the DEXA, dual energy X-ray absorptiometry, scan is the gold standard for measuring bone mineral density and diagnosing osteoporosis. MRI and CT scans may be used for other purposes, but they are not typically used for bone density assessment. 5. Which lifestyle modification is recommended for preventing osteoporosis? A. Decreased physical activity. B. Increased caffeine intake. C. Weight-bearing exercise. D. Low calcium diet. Answer: C. Weight-bearing exercise. Rationale: weight-bearing exercises, such as walking or strength training, help maintain bone density and prevent osteoporosis. A sedentary lifestyle and insufficient calcium intake can increase the risk of developing osteoporosis. 6. Which of the following medications is commonly prescribed to treat osteoporosis? A. Insulin. B. Bisphosphonates. C. Antidepressants. D. Beta blockers. Answer: B. Bisphosphonates. Rationale: bisphosphonates are the most commonly prescribed class of drugs for treating osteoporosis, as they help slow down bone loss and increase bone density. Insulin, antidepressants, and beta blockers are used for other conditions, not osteoporosis. 7. Which of the following is a risk factor for developing osteoporosis? A. Male gender. B. Regular physical activity. C. Smoking. D. Low-fat diet. Answer: C. Smoking. Rationale: smoking is a known risk factor for osteoporosis because it can impair bone formation and reduce bone density. Male gender, regular physical activity, and a low-fat diet are not risk factors for osteoporosis. In fact, regular exercise helps prevent it. 8. Which of the following nutritional supplements is commonly recommended for individuals with osteoporosis? A. Vitamin C. B. Vitamin B12.
C. Calcium.
D. Iron. Answer: C. Calcium. Rationale: calcium is essential for bone health and is commonly recommended as a supplement for individuals with osteoporosis to improve bone density. Vitamin C, B12, and iron are important for overall health, but are not directly related to bone health. 9. Which of the following is a potential complication of untreated osteoporosis? A. Hyperthyroidism. B. Bone fractures. C. Kidney stones.
D. Sepsis.
Answer: B. Bone fractures. Rationale: the most common complication of untreated osteoporosis is bone fractures, particularly in the hip, spine, and wrist. Hyperthyroidism, kidney stones, and sepsis are not complications directly associated with osteoporosis. 10. At what age should screening for osteoporosis typically begin for postmenopausal women? A. 40 years. B. 50 years. C. 60 years. D. 70 years. Answer: B. 50 years. Rationale: postmenopausal women are at higher risk for osteoporosis, and screening for bone mineral density typically begins at age 50 or earlier for women with additional risk factors. Screening is generally not recommended before this age unless other risk factors are present. 11. Which of the following is the most common cause of secondary osteoporosis? A. Hyperparathyroidism. B. Diabetes mellitus. C. Osteoarthritis. D. Cushing syndrome. Answer: A. Hyperparathyroidism. Rationale: hyperparathyroidism leads to increased calcium loss from the bones, resulting in bone weakening and secondary osteoporosis. While diabetes and Cushing syndrome can contribute, hyperparathyroidism is a more direct cause. 12. What is the recommended daily intake of calcium for adults aged 19 to 50 years? A. 500 milligrams. B. 1,000 milligrams. C. 1,200 milligrams. D. 1,500 milligrams. Answer: A. Hyperparathyroidism. Rationale: hyperparathyroidism leads to increased calcium loss from the bones, resulting in bone weakening and secondary osteoporosis. While diabetes and Cushing syndrome can contribute, hyperparathyroidism is a more direct cause. 13. Which of the following is the primary function of osteoblasts in bone remodeling? A. Bone resorption. B. Bone formation. C. Calcium storage. D. Bone mineralization. Answer: B. Bone formation. Rationale: osteoblasts are responsible for forming new bone tissue. Osteoclasts, in contrast, are responsible for bone resorption. Osteoblasts also play a role in bone mineralization. 14. Which of the following factors can decrease the risk of osteoporosis? A. High alcohol consumption. B. Smoking. C. Weight-bearing exercise. D. Low-fat diet. Answer: C. Weight-bearing exercise. Rationale: weight-bearing exercises like walking or running increase bone density and reduce the risk of osteoporosis. Smoking and high alcohol consumption increase risk, while a low-fat diet is not specifically protective against osteoporosis. 15. Which of the following is a characteristic of a vertebral compression fracture in osteoporosis? A. Sudden, severe pain. B. Pain that improves with movement. C. Localized tenderness over the fracture site. D. Chronic dull pain. Answer: D. Chronic dull pain. Rationale: vertebral compression fractures often cause chronic, dull pain that worsens with prolonged standing or sitting. Sudden, severe pain is more likely with acute fractures, while the pain of vertebral fractures may be persistent and gradually worsening. 16. Which medication is commonly used to reduce the risk of fractures in individuals with osteoporosis? A. Acetaminophen. B. Bisphosphonates. C. Antihypertensives. D. Antidepressants. Answer: B. Bisphosphonates. Rationale: bisphosphonates are the most commonly prescribed medications to reduce bone loss and fracture risk in osteoporosis. Acetaminophen helps with pain, but does not affect bone density. Antihypertensives and antidepressants do not directly treat osteoporosis. 17. Which of the following is a common side effect of bisphosphonates? A. Constipation. B. Gastric irritation. C. Increased appetite. D. Skin rash. Answer: B. Gastric irritation. Rationale: bisphosphonates can irritate the gastrointestinal tract, leading to symptoms such as esophageal discomfort or gastric irritation. Constipation, increased appetite, and skin rash are not common side effects of bisphosphonates. 18. Which of the following is a non-pharmacological intervention for managing osteoporosis? A. Calcium infusion. B. Weight-bearing exercise. C. Insulin therapy.
D. Surgery.
Answer: B. Weight-bearing exercise. Rationale: weight-bearing exercises such as walking, jogging, or resistance training help to strengthen bones and prevent bone loss. Calcium infusion and insulin therapy are not routine for managing osteoporosis, and surgery is only used in the case of fractures. 19. What is the role of vitamin D in osteoporosis prevention? A. It inhibits calcium absorption. B. It reduces bone formation. C. It enhances calcium absorption. D. It increases bone resorption. Answer: C. It enhances calcium absorption. Rationale: vitamin D is essential for the absorption of calcium from the gut, which helps to strengthen bones. Without adequate vitamin D, calcium absorption is impaired, increasing the risk of osteoporosis. 20. What is the impact of menopause on the development of osteoporosis? A. It increases estrogen levels, preventing bone loss. B. It decreases calcium absorption in the intestines. C. It decreases estrogen levels, accelerating bone loss. D. It has no impact on bone density. Answer: C. It decreases estrogen levels, accelerating bone loss. Rationale: the decrease in estrogen levels after menopause accelerates bone resorption, increasing the risk of osteoporosis. Estrogen is important in maintaining bone density, so its reduction can lead to rapid bone loss. 21. What is the function of osteoclasts in bone remodeling? A. Bone formation. B. Bone resorption. C. Bone mineralization. D. Calcium storage. Answer: B. Bone resorption. Rationale: osteoclasts are responsible for the resorption of bone tissue, breaking down bone and releasing minerals, such as calcium, into the bloodstream. Osteoblasts, in contrast, are responsible for bone formation. 22. What is the primary purpose of the DEXA scan in osteoporosis diagnosis? A. Measure bone mineral density. B. Detect fractures. C. Assess muscle strength. D. Evaluate calcium levels. Answer: A. Measure bone mineral density. Rationale: the primary purpose of a DEXA scan is to assess bone mineral density, BMD, and diagnose osteoporosis. It is not used to detect fractures directly or assess muscle strength or calcium levels. 23. What is the most common site of fractures in patients with osteoporosis? A. Wrist.
B. Spine.
C. Hip. D. Foot. Answer: C. Hip. Rationale: hip fractures are the most common and serious fractures associated with osteoporosis. While wrist and spine fractures are also common, hip fractures tend to result in more severe complications and disability. 24. Which of the following is a typical complication of untreated osteoporosis? A. Cyst formation. B. Fractures. C. Infection. D. Hemorrhage. Answer: B. Fractures. Rationale: the most common and serious complication of untreated osteoporosis is fractures, particularly in the hip, spine, and wrist. These fractures can cause severe pain, disability, and sometimes life-threatening complications. 25. Which of the following is the most common site for a spinal fracture in osteoporosis? A. Lumbar spine. B. Cervical spine. C. Thoracic spine. D. Sacral spine. Answer: C. Thoracic spine. Rationale: the thoracic spine is the most common site for vertebral fractures in osteoporosis, which can lead to pain, deformity, and height loss. Lumbar spine fractures are also common but less frequent than thoracic fractures. 26. Which of the following is a major risk factor for osteoporosis in men? A. Low testosterone levels. B. Increased calcium intake. C. High physical activity levels. D. High estrogen levels. Answer: A. Low testosterone levels. Rationale: low testosterone levels can increase the risk of osteoporosis in men, as testosterone helps to maintain bone density. High physical activity and calcium intake generally reduce the risk, and estrogen levels are not a significant factor in men. 27. Which of the following interventions is most effective for reducing the risk of falls in individuals with osteoporosis? A. Fall prevention training. B. Use of mobility aids. C. Strengthening exercises. D. All of the above. Answer: D. All of the above. Rationale: a comprehensive approach, including fall prevention training, use of mobility aids, and strengthening exercises, is most effective in reducing the risk of falls in individuals with osteoporosis, which can lead to fractures. 28. Which of the following is a common cause of secondary osteoporosis? A. Chronic kidney disease. B. Osteoarthritis. C. Rheumatoid arthritis. D. Multiple sclerosis. Answer: A. Chronic kidney disease. Rationale: chronic kidney disease can lead to secondary osteoporosis because of the kidney's role in calcium and phosphate metabolism. Conditions like rheumatoid arthritis can also contribute, but chronic kidney disease is more directly linked to secondary osteoporosis. 29. How does smoking affect bone health? A. It increases bone mineral density. B. It reduces calcium absorption.
C. It improves bone strength.
D. It has no effect on bone health. Answer: B. It reduces calcium absorption. Rationale: smoking negatively impacts bone health by reducing calcium absorption and impairing bone healing. This increases the risk of osteoporosis and fractures. 30. Which of the following foods is highest in calcium? A. Spinach. B. Milk. C. Beef. D. Eggs. Answer: B. Milk. Rationale: milk is a rich source of calcium, which is essential for bone health. While spinach contains calcium, it also has oxalates that bind calcium, reducing its bioavailability. Beef and eggs are not significant sources of calcium. 31. What is the primary benefit of weight-bearing exercise for individuals with osteoporosis? A. It increases bone resorption. B. It stimulates bone formation. C. It decreases muscle strength. D. It inhibits calcium absorption. Answer: B. It stimulates bone formation. Rationale: weight-bearing exercise, such as walking or resistance training, helps stimulate bone formation and maintain bone density. It does not decrease muscle strength or inhibit calcium absorption. 32. Which of the following medications is used to treat osteoporosis by inhibiting osteoclast activity? A. Calcitonin. B. Bisphosphonates. C. Parathyroid hormone. D. Estrogen. Answer: B. Bisphosphonates. Rationale: bisphosphonates inhibit osteoclast activity, reducing bone resorption and helping to maintain bone density. Calcitonin can also be used for osteoporosis, but bisphosphonates are more commonly prescribed for this purpose. 33. What is the role of estrogen in bone health? A. Increases bone resorption. B. Decreases calcium absorption. C. Increases bone formation and decreases resorption. D. Reduces vitamin D levels. Answer: C. Increases bone formation and decreases resorption. Rationale: estrogen plays a crucial role in bone health by increasing bone formation and decreasing bone resorption. After menopause, the decline in estrogen levels leads to accelerated bone loss, increasing osteoporosis risk. 34. What is the first-line treatment for osteoporosis in postmenopausal women? A. Parathyroid hormone. B. Bisphosphonates. C. Calcitonin. D. Teriparatide. Answer: B. Bisphosphonates. Rationale: bisphosphonates are the first-line treatment for postmenopausal women with osteoporosis as they reduce bone resorption and increase bone density. Other options such as parathyroid hormone or teriparatide are used in more severe cases. 35. Which of the following is a lifestyle modification recommended for managing osteoporosis? A. High sodium intake. B. Regular weight-bearing exercise. C. Smoking. D. Excessive alcohol consumption. Answer: B. Regular weight-bearing exercise. Rationale: regular weight-bearing exercise helps to increase bone density and reduce the risk of fractures. Smoking and excessive alcohol consumption are risk factors for osteoporosis, while high sodium intake can further reduce calcium levels. 36. What is the most common symptom of osteoporosis? A. Back pain from vertebral fractures. B. Sudden joint pain. C. Swelling in the legs. D. Red, inflamed joints. Answer: A. Back pain from vertebral fractures. Rationale: back pain, often caused by vertebral compression fractures, is the most common symptom of osteoporosis? Osteoporosis is typically asymptomatic until fractures occur. 37. Which of the following is a common cause of secondary osteoporosis in men? A. Chronic use of corticosteroids. B. High calcium intake. C. Increased physical activity. D. Low testosterone levels. Answer: A. Chronic use of corticosteroids. Rationale: chronic use of corticosteroids is a common cause of secondary osteoporosis as it reduces bone density by inhibiting osteoblast function and promoting osteoclast activity. 38. Which of the following is a characteristic of osteoporotic bone on X-ray? A. Increased bone density. B. Thickened cortex. C. Bone fragility and fractures. D. Soft tissue calcification. Answer: C. Bone fragility and fractures. Rationale: osteoporotic bones often show signs of fragility with an increased risk of fractures, particularly in the spine, hips, and wrists. Increased bone density and thickened cortex are not characteristic of osteoporosis. 39. Which of the following is an effective way to prevent osteoporosis in postmenopausal women? A. High-fat diet. B. Regular exercise and adequate calcium intake. C. Prolonged bed rest. D. Excessive alcohol consumption. Answer: B. Regular exercise and adequate calcium intake. Rationale: regular exercise, especially weight-bearing activities, and adequate calcium intake are key strategies in preventing osteoporosis, along with vitamin D to support calcium absorption. 40. What is the effect of excessive alcohol consumption on bone health? A. It increases bone formation. B. It reduces calcium absorption and bone formation. C. It improves bone mineral density. D. It has no effect on bones. Answer: B. It reduces calcium absorption and bone formation. Rationale: excessive alcohol consumption reduces calcium absorption in the gut and inhibits bone formation, contributing to decreased bone density and an increased risk of fractures. 41. Which of the following tests is commonly used to assess bone mineral density in osteoporosis? A. CT scan. B. X-ray. C. DEXA scan. D. MRI. Answer: C. DEXA scan. Rationale: a DEXA dual energy X-ray absorptiometry scan is the gold standard for assessing bone mineral density and diagnosing osteoporosis. CT scans, X-rays, and MRIs are not used for routine bone density measurement. 42. What is the relationship between low body weight and osteoporosis risk? A. Decreases the risk of osteoporosis. B. Increases the risk of osteoporosis. C. Has no effect on osteoporosis risk. D. Increases bone density. Answer: B. Increases the risk of osteoporosis. Rationale: low body weight, particularly a low body mass index, BMI, is a risk factor for osteoporosis because it can lead to lower bone mass and increased fragility. 43. Which of the following is a potential complication of untreated osteoporosis? A. Decreased blood pressure. B. Increased fracture risk. C. Muscle hypertrophy. D. Enhanced immune function. Answer: B. Increased fracture risk. Rationale: the primary complication of untreated osteoporosis is an increased risk of fractures, particularly in the spine, hips, and wrists. 44. Which of the following foods is rich in vitamin D? A. Spinach. B. Fatty fish. C. Beef. D. Eggs. Answer: B. Fatty fish. Rationale: fatty fish, such as salmon and mackerel, is a rich source of vitamin D, which is crucial for calcium absorption and bone health. 45. Which of the following is a key risk factor for osteoporosis in elderly individuals? A. Increased physical activity. B. Reduced estrogen and testosterone levels. C. High calcium intake. D. Increased vitamin D synthesis. Answer: B. Reduced estrogen and testosterone levels. Rationale: the decline in estrogen and testosterone levels as individuals age significantly contributes to the development of osteoporosis, particularly in postmenopausal women and older men. 46. How does a calcium deficiency affect bone health? A. It enhances bone mineralization. B. It accelerates bone resorption. C. It increases bone formation. D. It has no effect on bone density. Answer: B. It accelerates bone resorption. Rationale: a deficiency in calcium reduces bone mineralization, leading to increased bone resorption, which can result in bone loss and an increased risk of fractures. 47. Which of the following is a complication of severe osteoporosis? A. Increased muscle strength. B. Fractures and deformities. C. Enhanced circulation. D. Decreased blood glucose levels. Answer: B. Fractures and deformities. Rationale: severe osteoporosis increases the risk of fractures, particularly in weight-bearing bones like the spine and hips. Deformities such as kyphosis may also develop due to vertebral compression fractures. 48. Which of the following bone sites is most at risk for fracture in patients with osteoporosis? A. Skull.
B. Tibia. C. Spine.
D. Clavicle. Answer: C. Spine. Rationale: the spine is the most common site for fractures in individuals with osteoporosis, especially in the thoracic and lumbar vertebrae. Fractures can cause significant pain and deformities like a dowager's hump. 49. Which of the following is a key preventive strategy for osteoporosis in postmenopausal women? A. Excessive alcohol intake. B. Estrogen replacement therapy. C. High-protein diet. D. Prolonged bed rest. Answer: B. Estrogen replacement therapy. Rationale: estrogen replacement therapy is commonly used to prevent osteoporosis in postmenopausal women by helping to maintain bone density. Excessive alcohol intake and prolonged bed rest are risk factors for osteoporosis. 50. Which of the following conditions may be associated with osteoporosis as a secondary cause? A. Cystic fibrosis. B. Hyperparathyroidism. C. Asthma. D. Multiple sclerosis. Answer: B. Hyperparathyroidism. Rationale: hyperparathyroidism leads to increased calcium release from bones, causing bone loss and increasing the risk of osteoporosis. Conditions like cystic fibrosis and asthma are not typically associated with osteoporosis.